So we've recently done some videos on percussion massage guns. And in this video, I kind of want to talk about when we would actually use one of these things. So we've done some videos on different massage guns that have been sent in. This is actually a NAIPO, I believe I'm saying that properly, massage gun, NAIPO massage gun. And they just sent it over to me to test it out. And so, you know, we've done these videos recently, mini percussion guns, and so we've kind of got the question of, well, when do you use a massage gun and when do you advocate a massage gun be used with your athletes? And so kind of whenever we're dealing with one of these massage guns, we know that, you know, there's a perfusion of blood flow or interstitial fluids. So there's kind of this fluids that we have sitting between the muscle fibers, between muscles, and we're kind of distributing that a little more evenly, but we're also activating some nerve fibers that are primarily carrying stimulus that's a non-harmful stimulus. So we talked about the gate control mechanism or gate theory, where we can kind of gate pain a bit by saying, you know, we have pain, there's this noxious stimulus, let's input some non-harmful stimulus into the tissues, into the area, and see if we can try to break that cycle a little bit. What we're kind of doing with the massage guns is sort of that thing. So we know that percussion, or more accurately vibration, is often used in hypotonicity. So if somebody had a stroke or some neurological condition and they don't have tone, a lot of times we'll use it on the musculotendinous junction there and try to elicit some tone into the muscle. But when we're talking about percussion here, we're going to talk about a little bit deeper impulse, and we can kind of use it to, one, stimulate the nerve in a little bit of a non-harmful way. The other thing we can do with these massage guns is we have a really sore area. And a lot of times these sore areas, these trigger points, aren't necessarily getting the adequate nutrition and the adequate fluid that they're supposed to in order to adequately heal or to heal properly. So we get sore, we get this trigger point, one area of the muscle seems more sore, we can hit it with one of these massage guns, boom, 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 and try to influence a little bit of blood flow to the area, heat it up a little bit. And what's interesting is if you find someone that's really tight, they have a lot of tone, it's really uncomfortable for them to deal with any sort of massage, we can utilize these massage guns and try to decrease their sensitivity to touch and to massage, and then we can actually go into some of our lengthening procedures where we're actually lengthening the muscle. Now, as a therapist, are you going to use one of these in the clinic? Well, sure, you might use it. A lot of times they use them before a thoracic manipulation. When we could really use these is having athletes or having patients utilize them on their own time, save us time in the clinic, say, here are some different massage guns or percussion guns that are pretty good, or we can even say, hey, you're about to work out, why don't you come in 5 minutes early and hit yourself with a little bit of this percussion gun, which is very safe, it's easy to do, especially if they're doing it on the extremities, and then we'll get into things. So we can use it prior to warm up, give it a little bit of activation, decrease a little sensitivity, and then potentially activate some different nerve receptors, different sensory feedback that's going to be non-harmful, and we can kind of gate some of those symptoms, as well as say, you know, we have these sore areas, let's try to influence a little blood flow in the area, let's try to distribute fluids a little bit more evenly along the length of the muscle. And then we can get into some more deep tissue work where now the patient or the athlete can tolerate a little bit more deep pressure, and we can actually get into the tissues a little bit as we lengthen them. So that's how we like to use it. Now in therapy, we might use it time to time, but we don't spend a ton of time on it. I think the goal here when we're working with athletes is give them things, or patients, give them things that they can utilize on their own to make the most of their time, and then we can be more effective when they actually get in. So that's how we like to use different percussion guns, more so for the consumer, but we do use them time to time, especially if someone's really sensitive to touch, someone's acute, we can utilize some vibration, something like this, to calm them down. Now, we have to realize that if we're going to use them, We may have more effective techniques where we can use our hands and get into the tissues, but we can't replicate with our hands what a massage gun can do. We can't replicate this. So this is a different modality that we can use, and a lot of times it's really easy to give a patient something like this and have them utilize it on their own, and hopefully over a period of time use it to alleviate some symptoms at home and to manage their symptomology. So that's how we like to use massage guns and percussion guns. I'd like to thank NAIPO here. This is an awesome little gun, comes with some nice attachments, but regardless of what gun you get, you want to make sure that you're using these things in the right way and understanding that these things are a mechanism to get to other more specific techniques and not the end-all be-all. So we can use these to get to our exercises with more specificity, to loosen up some tissue prior to a workout, or to decrease some tone and some sensitivity prior to some manual interventions. So we'll see you guys in the next video. Make sure to subscribe and hit the like button if you like this video, and also check out some of our other videos on percussion massage guns. We'll see you guys in the next one.